Hello everyone, my name is Matthew Rosine and I'm here to talk to you about the COVID-19 vaccination. The objective of my presentation is to influence healthcare workers to receive the COVID-19 vaccination to ensure their safety and the safety of those whom they care for. This presentation seeks to provide education to these healthcare workers, including the benefits associated with receiving the vaccination to help stop the pandemic. Often myths and hearsay can deter individuals from receiving vaccinations, and these vaccinations will ultimately reduce an individual's risk of developing disease or the severe symptoms associated with COVID-19. Over 3 million people worldwide have died from coronavirus. The US alone has over 566,000 deaths. The coronavirus pandemic has affected most, if not all, people worldwide. This potentially deadly disease has made us all weary of gatherings with friends and family for fear of catching or passing COVID-19 to others. Although we are starting to see the number of confirmed cases and deaths drop daily, we must all continue to do our part to help to end the pandemic. Receiving a COVID-19 vaccine plays an important role in helping to stop the pandemic. During this presentation, I will discuss what the coronavirus is and provide education to healthcare workers, including the benefits associated with receiving the COVID-19 vaccine. My name is Matthew Rosine, and I am a senior at West Texas A&M University studying health sciences. So what is my health problem? The coronavirus disease 2019. According to Mayo Clinic, the coronaviruses are a family of viruses that can cause illnesses. In 2019, a novel coronavirus was identified as the Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. The disease it causes is called coronavirus 2019, or COVID-19. COVID-19 is easily spread from person to person through respiratory droplets that are released when someone with the virus coughs, sneezes, breathes, sings, or even talks. These droplets are then inhaled or land in the mouth, nose, or eyes of a person standing nearby and can infect them. So according to the WHO, which is the World Health Organization, as of today, April 28th, 2021, there have been 148,148,030 confirmed cases worldwide of COVID-19. There have been 3,124 deaths, or 3,124,905 deaths worldwide, with 961,231,417 vaccination doses administered. These numbers are staggering. So I personally have had experiences with COVID-19. In early July of 2020, I was diagnosed. The first symptoms that I remember receiving or noticing was increased fatigue. I was just very tired. This is followed by a fever. I lost my sense of smell, sense of taste, and I just felt weak. These symptoms persisted for approximately 14 days, and then I was able to fully recover. And I was very fortunate not to experience any of the respiratory issues associated with COVID-19. This was a scary time for me and my family, as my father-in-law was living with us and he has very many medical issues going on, and we were concerned that he may catch the disease from me. Also, during 2020, the facility that I work at was devastated by COVID-19. Over 60% of our residents and 50% of our staff was diagnosed with COVID-19, and this led to multiple deaths associated with contracting the coronavirus. Many of our residents continue to have complications stemming from COVID-19, including blood clotting issues and respiratory issues. So what are the symptoms? They can vary from person to person and from very mild to severe. Every person is at risk for contracting the COVID-19 disease, and healthcare workers are extremely high because they're often dealing with patients with COVID-19. High-risk patients include the elderly, people with serious heart diseases, cancer, COPD, diabetes, obesity, so on and so forth. There's a long list. Some of the more common symptoms include fever, cough, tiredness, loss of taste, loss of smell, shortness of breath, muscle aches, chills, sore throat, runny nose, headache, chest pain, nausea, vomiting, diarrhea, and rash. If you have consistent problems, you should consult your doctor. That includes trouble breathing, persistent chest pain or pressure, inability to stay awake, confusion, discolored skin, lips, or nail beds. So what are the causes of COVID-19? Well, according to Mayo Clinic, coronaviruses are a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome, or SARS, and Middle East Respiratory Syndrome, MERS. In 2019, a new coronavirus is identified as the cause of a disease outbreak that originated in China. The virus is now known as a severe acute respiratory syndrome coronavirus, SARS-CoV-2. The disease it causes is called coronavirus 2019 or COVID-19. So solutions, vaccinations, number one. There are 3 different vaccinations currently developed, the Pfizer, Moderna, and Johnson & Johnson. According to the statistics, Pfizer is 95% effective, Moderna is 94% effective, and Johnson & Johnson is 66% effective. As of right now, with everything going on with Johnson & Johnson, the FDA and the CDC has recommended that the U.S. continue to receive this because the benefits outweigh the risks. Vaccinations may prevent individuals from contracting COVID-19 or from becoming seriously ill or dying from this disease. Individuals that have received the vaccination will help stop the pandemic by adding to the number of people in the community who are protected and contributing to herd immunity. The prevention of virus spreading and replicating will also allow it to prevent it from mutating and possibly becoming more resistant to vaccines. Another solution is to continue using the social distancing protocols. Continuing to wear masks, staying 6 feet apart, washing hands, wiping down commonly used surfaces, and avoiding crowded areas. Are these proposed solutions feasible? Absolutely. Vaccination clinics are available throughout the U.S. If you do a quick online search, you can find one. Call your doctor. You can even go to a local CVS, Walgreens, pretty much anywhere right now is offering vaccination clinics if you call them. And then continuing to practice social distancing, that's just something that you have to reinforce how important it is, especially with friends and family. I know everybody wants to be close now, but we want to continue to maintain our distance, avoiding crowded areas, using our masks, and continuing to wipe down the surfaces regularly. So in conclusion, although the numbers of reported incidents continue to drop, we must all continue to do our part to help stop the pandemic and save the lives of our loved ones and friends. COVID-19 vaccinations and continuing to practice social distancing protocols will continue to help stop the pandemic and prevent the spread of this potentially deadly disease. And according to Jeffrey Kluger, vaccines save lives, fear endangers them. Thank you very much. Here is a little flyer that I made, concerning some of the myths associated with COVID-19 vaccinations. A list of myths and facts. Thank you.